It is a newly detected subvariant of Omicron, which is now being reported increasingly from several countries across the world, including India. Now, this does pose a bit of a problem in terms of diagnosis because some RT-PCR kits which were able to detect Omicron strain by is-seen dropout, we will not be able to pick that up in BA.2 cases. Hence, the reliance has to be on genomic sequencing to characterize whether it is Omicron or not. It is too initial days to really talk about BA.2, how different it will be. But what is emerging is that the clinical features are more or less same as that of Omicron. The disease it causes is mild, just like Omicron, but probably it may be more infectious, or what we call more transmissible between people. So there have been reports of its presence in certain countries, and it is fast, rapidly spreading in these countries. Can it cause reinfection in people who already have Omicron? Very less likely, because Omicron will give you cross protection or neutralising antibodies to most of these variants. Will the disease be more severe with BA.2? Unlikely, but we need more information. Over coming months only we'll get it. When we have a future vaccine against Omicron, will it work against BA.2? Hopefully it will work. Do we need to be worried, concerned about it? Personally, I don't think so. It should behave the same way as Omicron has in countries, in districts, in regions where Omicron has, come and gone. BA.2 will be very unlikely to get its footsteps in. In areas where Omicron has not yet happened, it may be more likely that BA.2 strain becomes increasingly more predominant. But we'll have to wait for a few more months to really get to know more about this variant. But we need to understand that most of these viruses, and especially COVID virus, will keep mutating. We have to learn to live with it and not worry too much about it. Use the precautions, masking, hand hygiene and distancing, and that is what keeps you safe. And of course, don't forget that vaccine will still be your most important sort of a protective step against any COVID infection.